Okay, so hello everyone. Welcome to this month's academic reading group session. I'm Florine de Wolf and I will be moderating this session. I'm a project and research assistant at the GLI. So I'm part of both research and project team here at the GLI. Our speaker today is Dr. Jason Paltzer from the Wisconsin Lutheran College, and he will speak about his research. And Dr. Daniel O'Neill from the University of Connecticut will respond. Daniel is also the managing editor of the Christian Journal for Global Health. This session will follow the usual format. For those of you who already attended, you're familiar with this format. So Jason will present his research for around 20-25 minutes. And then Daniel will respond for around 10 minutes. Then we will have short time for question and answer and comments. As I was saying a bit earlier, we're still looking for speaker and responder for the remainder of the year. So I'm just gonna drop the link in the chat if some of you want to present your work at one of our next session. I will now hand over to you, Jason. The floor is yours for the next 20-25 minutes. Thank you.
Thank you, Florine. It's a privilege to be able to speak with you. And Dan and I are grateful for the opportunity to share this area of building a health research collaborative for Christian faith-based health organizations. My name is Jason Paltzer. I am currently a visiting professor at Wisconsin Lutheran College and also a research director for an organization called Kingdom Workers. In the next few months, I'll be transitioning to being executive director for what we're currently calling the Maros Research Community, which is a type of collaborative built on some of the things I'm going to be sharing with you today. So that's kind of an exciting transition as we put into practice what we're trying to learn in this space. I currently live in Phoenix, Arizona. I spent about 6 years working in Central Africa and Zambia, specifically in health and development. My background is in public health. I was then came back to do my PhD in the United States at the University of Wisconsin, where I was born and raised. And my PhD is in population health sciences with a focus on social and behavioral health. I was a global health director for a while and then got into academia at Grand Canyon University and Baylor University. I just share that with you because I am really excited to move into this space to balance my experience in practice with my experience in research. And I know all of us are kind of in this space of how do we do this well and how do we balance this practice with the research to continue to understand the evidence, grow in our organizations and our capacity to serve people with better programming and better services that we can really improve health, whole health for individuals, families, and communities. With that, I am going to get into my presentation and share with you the results of our study. If anybody has challenges hearing or seeing, please let me know. So I'm going to share with you a study about the feasibility of establishing a Christian collaborative for health research. What we'll cover today, I'm going to briefly talk about the need for a collaborative. I'm going to talk about the study methods, key findings, and then some next steps. Some next steps that a few organizations are already taking, including GLI and the work GLI is doing. And then also some real practical things that other organizations might consider to create a pipeline for this. So first, the need. Spirituality is an important health determinant, yet many faith-based organizations do not push or pull research to inform practice and partnership. We know many organizations are doing evaluation of their programs. Some of them aren't even analyzing it much less sharing it with others. So even though there's a strength of evaluating with our organizations, how do we build on that to move toward research? The evidence of program components and models in the literature is missing. It's a current gap I think all of us are aware of. And when we go to look for evidence-based models in this space of holistic health ministry, we're not seeing it. Organizations and faith-based organizations have difficulty accessing the research and getting the information. Many journals are closed access, and so getting those papers or that information is challenging. And once it's challenging, it can be, people stop looking for it. There can be a feeling of isolation of organizations thinking that the research just doesn't get me, different. They don't understand the context I'm in. This study only applies for this particular group in this particular space, which can be true. But then how do we move toward having a contextualized study or evidence for that particular space? So understanding this area of need can be helpful to frame our messaging as we help create this link between research and strengthen this link between research and practice through a type of collaborative, all because we want to move toward SDG 3 and 17, right? Health and well-being and partnerships as key components to improving the health of communities throughout the world. In our particular study, we focused on identifying the evaluation and research experience of organizations. Many of the organizations that responded were small to medium size, which is kind of the group we were targeting. We also wanted to know what their research and evaluation interests and objectives were at the time of the study. We wanted to understand barriers to doing research that they felt and experienced, and also priorities from their end on why they would participate in a collaborative. What were things that they would want to get out of it? And then we assessed the feasibility of establishing a collaborative, and we asked them what their willingness to pay for some services or for participating in a collaborative would be, just to see is this financially sustainable. You can see the link below there, and the PowerPoint will be shared with everyone, so you'll have the link to the article. It was also sent out in prior messages about this webinar. I just recognize my co-author, Kiana Taylor. She's now a PhD student at the University of California in Los Angeles. We partnered with a number of Christian health networks, Christian Connections for International Health, Health for All Nations, Global Chain Network, and we had them send out the link to the survey in their email newsletters. They use social media, Twitter and Facebook to get the survey out there. We excluded academic organizations and government agencies. This was a cross-sectional digital survey, English only, so that is a limitation. And one of the reasons why you don't see South America represented, we see Africa, Asia, and North America represented in the respondents. We had 116 respondents, which again, a limitation, a fairly lower end for the study, but we feel like we were able to get some good information from those that responded. I'm going to just share with you high-level results. And these are the 4 main findings that we found of particular interest, and hopefully you do too. Over 80% had desire to disseminate their impacts more broadly. This is beyond just doing an annual report for their organization or sharing with donors or sharing with their communities what they're doing. They had a desire to truly disseminate their impacts more broadly among other organizations, but then also to receive that information and learn what others are doing. 37% of them had experienced publishing in a peer-reviewed journal, but 64% of them had a desire to do so. So this debunks the myth that organizations don't want to do research. They do, but there is a gap in the experience and their desire and their knowledge in how to do that. So this was reassuring for us to see this and know that, yep, there is not only a need for this, but there's also a growing demand for organizations to get involved with research and publish and disseminate the results. but there are barriers. So the top 4 barriers that we identified: financial, of course, no surprise there, just the finances to carry out a study. Number 2, time to specifically write and publish it. So again, as I mentioned before, organizations are doing some of the evaluation and analyzing the results, but the time to actually write and publish those results in a way that can be shared, right? How do we evaluate findings? How do we, or not evaluate, but how do we report findings in a way that can be easily understood, communication process of research. Number 3, knowledge of methods, right? How do I go from evaluation to research? What are some research methods that would be helpful for me in my context? That was a barrier. And then time to collect and analyze the data. So the other side of the research, not just the writing and publishing, but even before that, how do I find the time to collect and analyze the research? These last 2 were specific for or higher among non-US based organizations. And I call that out just to remind us that, where your organization is based might influence their particular barriers. And so just to be sensitive and aware of that US-based organizations really highlighted finances and time to write and publish. US or non-US based organizations really highlighted this knowledge gap and the time to even collect and analyze the data before even getting to the publishing and writing part. Over 90% of the respondents were willing to pay for services. Now, the willingness to pay was around the $500 mark, so definitely not enough to cover a study. However, it does show a willingness to participate financially in this area. So again, that was reassuring. There's going to any type of collaborative that is developed will need to develop a business model that goes into financing and funding the connections that people are making. I'm going to share with you some ideas on how we plan to do that in a way that just gets others involved too. We want to see research to build the evidence, but also to build capacity, and there's a common saying, we don't just use people to get work done, we use work to get people done. We want to use research to get people done in our work as well. So this is a type of collaborative framework that we were able to build from the information we gained from the study. This shows a leveling of how we move toward disseminating impacts. So many organizations are already doing some type of evaluation, but there is a need, and the study showed that there is the desire to increase the level of evaluation services and resources. So we can start there. We can provide some different types of evaluation tools that help organizations increase the robustness of their current evaluation practices. We can help them integrate spiritual impact measures, really helping them clarify and define what their ministry models might be or what their program components might be that would include a spiritual component, and identify ways to measure them alongside physical, social, and emotional determinants of health. We can support them with some grant finding opportunities and grant writing opportunities, whether it's through foundations, whether it's through international organizations, whether it's through individual churches. I had one church in Wisconsin want to fund a study of domestic violence in the Midwest, and they gave us a small grant from a church to do this study in Wisconsin, in Milwaukee specifically. So there are people out there wanting to support research in this space, not just large grants like the Templeton Foundation or others, but even smaller ones just to get started. And often that's easier and better for organizations just getting into research because it's just easier to manage. But then moving from evaluation skills and resources to that research design piece, right? So transitioning from evaluation to helping organization answer those questions of why and how. And oftentimes that can come from evaluation, right? So evaluation will show us, is our program working or not? Well, if it's not, why or how is it not working? And that's where we get to start testing our assumptions and moving into the research space. And it can be a good transition for an organization to understand, how do I move from evaluation to research? But we learned that organizations are looking for research design services. How do we help them think through the research design process? What kind of study might work for this particular question? considering qualitative and qualitative study approaches based on the type of question, the type of data that they need, and the population that's available to them. But just thinking through these components of research can be really helpful for an organization having somebody available to help them do that. We can also connect them with researchers with a well-defined project. So once they get a good question, they get some idea of what possible methods might be. It's easier to connect them with a researcher or a faculty member that might be interested in that. But often it takes that connection, right? Understanding the movement from evaluation to research design and services, and then moving toward disseminating the impacts, which is where we all want to get to, strengthening the evidence base for these programs that are out there, including what kinds of spiritual determinants and components are integrated into their programming and how is that working, right? So providing analysis consulting, helping them with the analysis, helping them with the article editing to get to a product that's publishable. Creating other forms for dissemination. Maybe it's an organization research forum, right? Where it's just for organizations to come and share research ideas or research results for sharing those ideas. So identifying those different ways to disseminate impacts. So that they can see the fruit of why they're doing what they're doing, and that it builds on our collective knowledge, our collective pool in this space of serving faith-based health organizations and their communities. As we move into the people that are going to be involved with the collaborative, I wanted to highlight 4 main groups that I've seen are important for us to create pathways into a collaborative. And often those pathways are different and unique for that group. Faith-based organizations, for example, the pathway into a collaborative for them might look like trainings. Could be an online training, could be a freely available self-study course. Some other available resources, maybe it's having a database of spiritual health metrics and instruments that have been used. The God 10 scale, the spiritual well-being scale. Some of these instruments that have been used so people get an idea of what kinds of things they might be able to ask in their studies. Researchers, right? It's developing a pathway for researchers into this. And one way we're doing that is by creating what we're calling a consortium of Christian health science researchers. So this is a group of researchers that have come together. It's a cohort of 15. We're working with Health for All Nations on this project. And these researchers are coming from the US and a group of from the Philippines. This is our first pilot at this, but it's just meant for researchers to give them a space to start sharing ideas. Again, the same thing. This isn't meant to have already completed studies or studies in the midway point. This is like a think tank for researchers to consider ideas in the space of faith and health research. We have a pathway for students. We see students being a key link in building this collaborative because they're willing to go places, they're willing to spend time in the field, data collection, but they also require some training before they get to the field. So we are helping campuses and universities in Wisconsin develop what we're calling faith and health research student organizations. So we have a student organization established at Baylor, and we're working on one at Wisconsin College. But this gives us a direct feed into a group of students that are interested in this space. We can train them and get them connected with organizations to help with some of those barriers. That time to collect data, even oftentimes if you get students involved, you're pulling in some of those faculty as well and some of those researchers. So now we also get assistance with analysis. This helps reduce the cost of an overall study. Currently we have 2 students in Guatemala working on a project in community health evangelism. We're working with the Global Chain Enterprises as our organization partner, and they are working in communities collecting data. We also will have students going to Ghana to do the same. So benefit of a collaborative is that we will increase our sample size as well, which will strengthen the evidence base. So we get to bring like-minded organizations like these 2 community health evangelism organizations, one in Guatemala, one in Ghana, bring them together and collect some same measures. So we get to do some comparisons between countries as well, using a similar ministry model. So that's a pathway for students to get involved, and then also church leaders. Oftentimes the church leaders are gatekeepers for faith-based organizations. So getting them involved and giving them knowledge and information on community health ministry, holistic health models that are important for your organization could be really important. This doesn't have to be intensive. Again, it could be one of those self-study courses, but specifically for church leaders. It could be a course in seminaries or other faith-based training or schools and programs. I want to transition into some discussion points that have come from this, and some of them I've already mentioned, but just good to highlight. Moving from evaluation to research, but then to innovation. And I don't want to miss that last step. That really what we want here is we want to test our assumptions through research, but then we want to move toward developing some innovative, better practices to serve more people with our work and our organizations. Really, that's what we hope to get this through this, not just strengthening the evidence, but evidence for decision-making, evidence for innovation. We may need to reframe the word research. Research can be a scary thing to organizations that have one way of seeing it. And ways that I've experienced reframing research is by using the word stewardship. So using some faith language that helps understand why we're doing research. That's really stewardship and accountability in the work we're doing. And it's also storytelling. That this isn't just a bunch of numbers and surveys that will go back to the main office and then write a paper in a journal that no one can access. This is not that kind of research. This is storytelling, and it's helping our communities tell their story. It's helping organizations tell their story, so that we can be good stewards of what we've been given. Addressing the barriers of finances and time by bringing in more people. And in the previous slide, I showed ways of how we might do that, bringing in different types of people, students, education faculty that are at education colleges that have a high teaching load that want to do research, but otherwise probably don't have the time or the space to do it. Are there small scale projects and studies, organization connections that we can help them with? They have the skills and experience, but maybe we need to bring them in a different pathway. Foundation leaders as well, finding foundation leaders, small foundation, family foundations that are really interested in a particular topic or research area that your organization might be involved in. And then also encouraging organizations to use and test metrics that align with their theory of change and program models. And sometimes organizations may not really know what their theory of change is. They might be able to tell you stories and give you program components, but thinking more high level of yes, but what actually is your integration of spirituality or religiosity that you're bringing into your program? How does that come through in your education? How does it come through in your services? And how can we test that? What are questions we can ask in knowledge, attitude, and practice that would help us know that the recipients or the beneficiaries or the communities are understanding some of this? So we're doing that in the Community Health Evangelism Survey, really asking individuals about their strength of faith and about some of their spiritual practices that would probably come from engaging with HA program. But it involves knowing specifically what your theory of change or program models are. A collaborative also needs to address other issues that come up in research. IRB is a big one, or ethics approval, whether it's from your host university or in the country you're working with. Oftentimes it's both and. That can be a challenge. It can be time consuming. It requires having connections with people in the country to know even who to ask in terms of the application process for getting ethics approval in the country that you're seeking. But a collaborative can help do that. And if there's already existing connections in some countries, that can really speed up the process. And just really outlining data collection, right? Once you have the research design, who does the actual data collection? Who helps support it? And you don't want to just gather data just to get it done, but you want the data collection process to be part of that storytelling, to have a time of listening, sitting down with families or individuals and having them complete a survey. Doing a digital survey is quick and it's easy, but you miss that engagement, you miss the relationship building. And I've learned that research can be a means of relationship building, and it can actually be part of your program and part of your organization's strategy to serve people. It's a great time to reflect and to learn from people in a relatively objective way that research offers. So some next steps. Here are a few collaboratives that have started or are taking shape or that are already going. And I include JLI in this. That you guys are a hub of learning, you're a hub of resources, you're a hub of connecting researchers with practice. So I really appreciate this opportunity to share this with this group. We're also creating a research community called the Maros Research Community, and it's a joint venture between Kingdom Workers and Wisconsin Lutheran College. It will not be related to a particular denomination. It will be open and very accessible. That's our plan, and sort of creating a bit of a research community for the different groups that I outlined above. There's also a growing entity called the Global Health Research Institute, and that's affiliated with Health for All Nations and William Carey International University. Health for All Nations was, we worked with them with this study, so it's kind of neat to see a couple of things spinning off from this article and what we've learned. And there's also a growing faculty partnerships group with the Accord Network. So those are just a few examples of how this has sort of initiated some actual practical next steps. I also want to share with you a few things that other similar groups might use to bring in different people into the collaborative. As I mentioned before, I think there needs to be different pathways. So I mentioned the Consortium of Christian Health Science Researchers. We have the first cohort started. We'll start a second cohort in January. We cap them at about 15 to 20. Just because we want to make it a more intimate setting, and we want to really nurture those collaborations coming from these consortiums. We're starting, as I mentioned, faith and health research student groups on campuses to help foster students that are interested in really connecting their interest in health with their faith. We want to create a marketplace for research and organization connection. So whether that's in these specific forums or whether it's in the website, and building in opportunity to share profiles. So an organization might share a research design idea, and a researcher might share their profiles in their research interests, their research skills. Some of them are qualitative, quantitative, epidemiology background, maternal child health background, infectious disease background, whatever it is that might be, and they can kind of search for each other, and they can find who's got that product or who's got that service that I need, and make a connection through that marketplace. We are also developing an online health research method certification. This is going to be about a 28-week certification, and it'll be specifically for organization staff to give them the capacity. Not that they're going to be researchers after this brief training, but at least have some of the language, debunk some of the scariness around research, and give them a bit of confidence that, yes, I can do this. And not only can I do it, but I want to do it and have it be part of our organization's DNA, that we do this, we move from evaluation to research to innovation, and really have an abundance mindset when it comes to sharing, that we don't have to be a competitive framework or a competitive organization. We can be an abundance organization and share what we have and learn from each other. So those are just different next steps that I think no matter where you might be or where you're coming at this in terms of building a type of research collaborative, a faith-based research collaborative, some of these things might be helpful in thinking, how do we bring in some of these, whether it's organizations, faculty, researchers, or church leaders into this space. Again, my name is Jason Paltzer, and I'd be thrilled to connect with any of you that you're interested in learning more or have an idea to share on how to build faith-based health research collaboratives. Thank you, Florine. I will now turn it over to Dan.
Thank you, Jason, for your presentation. And as you said, now we hear Daniel comments and response on what you just said. Thank you.
Yes, thank you, Florine. Great, thank you, Jason, for that presentation. I really appreciate the articulation that you've spent and the preliminary research that you've expressed to us regarding building, from the ground up research collaborative to be able to meet the needs that are out there. I appreciate working with Jason on Faith and Health Working Group with Christian Connections for International Health. And my background is I'm the leader of the Evidence Working Group for the Moral and Spiritual Imperative that's convened by the World Bank. And so in this multi-faith space, we have identified the fact that there's missing pieces in terms of the integration of faith and health, but also the procurement and distribution of evidence base, which many multilateral organizations are calling for, including the World Bank, UN. But that often is a slow go process. So I think this type of research and this type of initiative helps move the ball down the field, so to speak. And I think the faith sector also needs some stimulus, if you will, for evidence building, highlighting this need for research, design, measuring, evaluation, and learning, and so I think this it moves toward that. So this needed gap is internal, which so within each faith community, there's these gaps between faith and practice, faith and development, faith and health. This particular study and this particular initiative is in the health sector, and in a particular faith group, the Christians. But it could be representative for many other faiths, many other sectors, to try to build evidence and to try to address issues related to that gap that is there. So I look at this as more of like a scoping study, kind of looking at a need. It's a drill down, so it's not a multi-faith initiative. It's not a multi-faith assessment or analysis, but it still is important, and it could represent an important aspect of in the multi-faith community, allowing Christians, Muslims, Hindus, Buddhists to assess their own needs. And this particular focus is not so much on policies as it is on community-based health initiatives, and that's important too. And I know JLI is local faith communities, and the localization of aid is a big issue. So listening to the voices of not just the ones who have the power, the money, or the connections with governments, but from the grassroots up. So I think that's of value. The introduction on the paper that Jason wrote, that we published, so we, as a publisher, we take some responsibility for what gets published. So I can't be too critical because we published it. That'd be kind of retro, but in his introduction, he had significant, excellent description of the need. He also mentioned an important thing that I wanted to highlight, which is the holistic health and integral mission. Is it might be a moniker that is more in a Christian community, but it's still two important aspects of what this initiative seeks to meet. Holistic health, meaning health providers, public health efforts need to consider the spiritual aspects of health. And integral mission means the mission-minded folks within the Christian community, we might use that term, need to integrate human health and development into their initiatives. So those two aspects, I think, are hopefully outcomes of this type of initiative. The limitations that I might mention on the paper to start with, the low response rate, excuse me, the survey was sent to over 1,000 organizations, had an ultimate N of 114, so that relatively low response rate. Yet survey-based research, it tends to have a low response rate, so I don't think that's too out of the norm. But that does lead to potential selection bias. Why did the people who filled out the survey fill it out? Is it because they're interested in research and it sort of self-selects out people who are interested? Or is it just people have more time on their hands because they're not busy enough? The limitations too, there were 3 networks that were chosen that were multi-denominational networks, and yet there might have been other networks that could have cast the survey out wider. the exclusion of the academic, there was 12% of respondents were from academic higher education. And I believe they were excluded. So that might be a limitation or question mark in our minds, is like, academic centers who we're trying to collaborate with for research capacity building, who have students who have interest in evidence and procuring evidence, might not have had their voices represented. And also people who are people of faith who work within government systems might have something to say in terms of the collaboration that might occur from a research collaborative. And of course, the limitation, because it's one faith, and that is the Christian faith, and it was in the English language, that excludes, especially even the other colonial languages, French, Spanish, primarily Portuguese, and then Mandarin. I mean, there's important limitations there. There was a drill down in terms of U.S. versus non-U.S. I'm not sure how helpful that is. There's some value in that. So some of the reflections I might say regarding this presentation in the paper is that evidence building, that the objects that were discussed in the paper and identified through the research barriers, that is money, time, and knowledge, but also will. Now, a survey might say, I have the will to do more research, but if there's a will, there's a way, and there's no way, then perhaps the will is questioned. Or the ideal is not necessarily, the ideal is not met because of really a lack of will. So how do you procure resources? How do you procure interest? How do you make people have more time to do this? Will a collaborative do that? And that's a big question. The evidence building requires some will. There is a call to evidence building from multilateral organizations. You see this in the World Bank. Where's the evidence? Where's the evidence from faith-based organizations? And meanwhile, faith-based organizations are doing a lot of work and yet not measuring, evaluating the results. If they are, they're not doing it really well. And if they're doing it really well, they're not sharing it. And so this idea of dissemination, this idea of sharing is really, can meet a need on the part of multilateral organizations, governments, to be able to see what on earth these people are doing, and also to perhaps collaborate with them, both from federal, state, local governments, multilateral organization funding. In that sense, it can be helpful, but also for donors. Donors are increasingly within at least the Christian community and in other faith communities looking for results. They're looking for impact, return on investment. And then I think there's the missional component. So from this particular faith, using language that would cause or perhaps stimulate some degree of increased will on the part of FBOs to engage in setting aside personnel, setting aside time, setting aside money to be able to procure evidence and share it. And for example, in the Christian community, it would be how to represent the Lord well, let's say, or Jason mentioned stewardship and responsibility, accountability, transparency, etc. These are Christian values, let's say, that in this particular case, that could be of value to build the will. And then I think the capacity building side of things, we all want to build capacity. We want to move from small to big, from doing to thinking to then doing better, from qualitative storytelling to quantitative evaluation. We want to use outputs, move from outputs to outcomes. The other thing I would mention is collaboration can be of value even if it's within a Christian or a Muslim or a Hindu or a Buddhist communities if there's interdenominate, because there's a lot of fractions in our faiths. So there is an important collaboration that occurs between denominations because everyone has their own opinion about everything. So, but if we can rally around better practices, better evidence-based truth-seeking, we could say, and then service. We want to improve our services. But the idea of collaboration is important because it's not a top-down, this is how you do things. And that's why I think the importance of this collaborative is helpful, because it looks at 4 different areas and it empowers students, empowers pastors, empowers FBOs to participate in this centralized sort of movement, if you will. It could be a model for other faiths that other faiths might apply this using different language, using different texts of ancient texts, their own scriptures, and that might help build capacity in terms of buy-in for money for research, so that an FBO can say, well, we're going to have 20% of our budget go toward research, measuring, evaluation, publishing. That can move, I think, better toward trying to bridge this, faith and health divide. And with JLI, I worked with Dean Collett and James Duff on this Guide to Excellence of Evidence a number of years ago. We try to extol accountability, service, research, and holistic or spiritual measures and metrics. So the study that Jason presented is interesting. I think 80% interest in building capacity for information management, publishing, sharing information, research, and evaluation methods, which a lot of people have. And as a publisher, we're sort of running into limits at the level of designing studies before they even sit down to try to write it. So this, from our perspective as a journal, we would appreciate that well-designed studies before they start sitting down at the typewriter. And then 64% want to publish, and I would definitely look forward to receiving more publishable material from the faith-based community. The other thing I'd mention is that faith-based organizations can, in a sense, if they come to the table of evidence building with data that's believable, with data that's true, that can be persuasive, then in a sense, they can also offer a prophetic voice about how do you measure, evaluate results. Is it all quantitative? Do we only listen to numbers and charts, or do we listen to stories as well? So, and Jason did bring that up. So that's about all I have to share. And I really, again, appreciate Jason's effort here, and I look forward to working with him and with the others in this collaborative, these projects that are being initiated. Thank you, Flona.
Thank you, Daniel, for sharing those points. Jason, do you want to respond to anything directly before we open it up to everyone else?
No, I'm really curious to hear any questions that are out there, or any other thoughts or viewpoints from others.
Okay, great. I see we have 15 minutes left, so anyone has questions or comments for Jason and Daniel?
Hi, this is Kathy at CCIH. Hi, Jason. Hi, Daniel. Good to hear this work. I have a question. When you had the graphic that showed the 4 groups, sorry, including church leaders. And I wanted to hear a little more about how you anticipate involving them, or any more thoughts you had on that.
Yeah, thanks, Kathy. So, number one, engaging seminaries and seminary faculty. I was just in Zambia last 2 months ago, and I was at a seminary there, and a couple of faculty, they were talking about alcohol use and alcohol influences among their students. but then also among their congregations. And it's like, hey, would you guys be interested in learning more about that in this context? And they'd be like, yeah, we were interested. So all of a sudden we started thinking about and brainstorming about a study with those seminary faculty. So that's one way, sort of an example of just having conversations that are intentional on where is their pressure point and how could that be sort of reframed into a study, getting them directly involved in it. Another part is having short courses, professional development courses for seminary students. Maybe it's not part of their formal curriculum, God willing, that might come to be the case. But just having a psychosocial counseling course for seminary students, just to get them into this thinking of community health and how might this impact my church's health, my congregation's health, and what do I need to know about it, right? So those are a couple things that I think we can moving the ball toward getting them interested. I think what Dan said about the will, creating an interest in this area of community health, and then a desire to support, if not get involved with some of the research. So professional development training, specific studies that impact their area of ministry, then also pastoral opportunities. So I'm going to be attending a symposium for pastors in our Christian faith on compassion ministry, and they're talking about compassion ministry. So can we be represented in those spaces where they're already gathering, right? So that's another opportunity. We are just using that to connect with pastors, sharing them with them what we're hoping to do, and not all of them, but at least maybe a few will desire to get involved.
Thank you.
Catherine, I see you have your hand raised.
Sure. Thanks very much. This was very interesting and obviously very, very well crafted, and appreciate Daniel's challenges, but also affirmations. I mean, to some extent, at a very broad level, we're all dealing with what I think are some really framed issues around evidence, and sort of this vague sense that there's a missing link, a lack of rigor, etc., that for some people is a general way to explain why they're uneasy about working with faith communities. So I think we're sort of dealing with that elephant in the room somewhere, but we're also, I think, dealing with what you point out as the very practical issues of the argument, I'm too busy helping people to fill in stupid forms and to do the classic work. I think there's another element that we hear, which is that a lot of the faith-based organizations are not really up on the literature and the research. In other words, they're dealing with all sort of old-fashioned or partial understandings of the issues. So I think that that's another sort of directional thing that's interesting. But what I was curious about was, I guess the term that someone was using was the prophetic. In other words, is there a disruptive element that you're picking up of the sort of conventional peer-reviewed randomized control trial truth is distorted itself and moving in different directions, which takes us to what, frankly, I think is a sort of dead end of trying to have the DNA of, quote, faith. I mean, I think that's a path that we really don't want to follow, though a lot do. But are there really disruptive ideas out there that we should be picking up?
Katrina, thank you for your comment. I would love to turn this back over to the group and get your thoughts. That's a great question, and I think I've shared some of the ones that I think, but it is important for I think, researchers in this kind of collaborative to understand the mission alignment with organizations, with maintaining a level of optimal ignorance, in terms of not just relying on our assumptions as truth, but what do we want to define as, number one, how do we define our assumptions in our programming, and especially as they include our aspects of faith that we're bringing into it. And then how do we have those conversations so that organizations feel comfortable working together? I think often that's an unspoken thing as well. I just don't want to work together because I just have we have our own belief system, and we're not sure what others might be thinking or what others might be believing. And so how do we come to a place where we can honor where we disagree and also appreciate where we agree, and move toward areas and studies that help us build in those spaces? But it does take a level of vulnerability. It takes a level of openness, and how do we help all of us get to that point where we can truly collaborate? So those are just some of my thoughts in terms of my conversations with organizations, and how to have this sort of alignment and mission, respecting their purpose and their vision as an organization, but then also wanting to get at testing some of those assumptions that we might hold dear. They could be traditions, they could be beliefs, they could be things that might be hindering some steps forward. So that's a tough conversation. Dan, additional thoughts on that?
Yeah, I mean, I like the word disruptive, and I think the problem with peer-reviewed literature is that if it doesn't make the cut into that realm, then it doesn't exist in the minds of most policymakers. And if it does exist, it's anecdotal and irrelevant. So I guess the big question that I think that maybe you raised, Catherine, is like, can the faith community redefine what it means to have evidence, or what is enough evidence to be able to inform policies that will be a game changer? At the same time, I think the faith community needs to be drawn into the evidential workings of academia and the evidential workings of international policy, because otherwise they're going to be left in the dust. And they'll just be sort of noting to self or their partners some outcomes and ideas. So I think it's both. I think that we need to not be afraid to use, and it's a lot of it has to do with interpretation. I know you've spoken to this, Catherine, and some of your publications before about faith language differing from evidential language, and how do you translate those things so that we're actually looking toward common goals, which is poverty alleviation, well-being, human flourishing, health in this case, in this sector. And if we have common goals, then maybe we can, as part of that collaborative effort, is to work together to put away our differences and be able to work toward that goal. So I think it can be capacity building in that sense. At the same time, the prophetic voice of the disruptive element can be, have you considered, or this is an important element, the social determinants of health. Does it include faith? Does it include spirituality? If it doesn't, then maybe it does need to. And getting a space for that to be, spoken, gives voice, I think, to the faith community.
Thank you. Any other last question, comments, or reaction before we finish the session? No? Okay then. Yeah, thank you everyone. for joining us today, and particularly thank you, Jason, for your presentation, and Daniel for your response. The next session will be September 8th. And as I mentioned at the beginning of the session, we still don't have speaker respondents. So if you want to present your work, please sign up. Thank you, everyone, and have a good rest of your day and week.
Thank you, Florine.